I think being a rheumatologist is a very good background for the kind of work that I did, and actually is a good background for clinic work in developing countries in general. Although you do see a lot of infectious disease, still, like in America, a good 20-30% of people presenting to a walk-in clinic have musculoskeletal complaints, and so being a rheumatologist makes you particularly well suited to those kinds of complaints. Health and Harmony is a very, very well organized opportunity in a very pleasant part of Borneo. Borneo happens to be a very large island, and parts of it are extremely primitive, the interior. But other parts of it are relatively more developed, but still very impoverished. Patients are charged for both the clinic visit and for the medications, and they're charged to a great extent on their ability to pay, and so they can be charged. There's a monetary charge, but then there's a conversion rate from the monetary charge to a certain number of barter options. So those barter options include working in the other arm of the Health and Harmony, which is the forest preserve and the organic farm, and so they can offer to work in that venue in place of payment. It's a walk-in clinic in the village that has 3 or 4 exam rooms, one room that you can hold people for 1 or 2 rooms that you can hold people over a prolonged period of time, and sort of an urgent care facility, which is sort of like an ER, but really not. Your ability to pursue patients' problems in an analytic fashion is something that is not that well taught in developing countries. It's mostly pattern recognition, and rheumatologists have a wonderful training in analytic approaches because we deal with a lot of fairly abstract concepts, and so we were always forced to clarify what are the objective, features of the disease, and how does that relate to the possible diagnoses that you're considering. I did see patients with rheumatoid arthritis, and we treated them with methotrexate, not unlike America. We had a difficult time getting certain lab tests, but we had a decent time getting others. We could get blood counts because we were given a Coulter machine. You are much, much more reliant on your physical exam and history skills. And that is something that rheumatologists are also very, very comfortable with, because we have to sort through very vague complaints, and we do it largely by history and physical exam. They also run outreach clinics, and every couple of days they send a truck out with one of the interns, one nurse, and a driver, and they drive to some inland, fairly remote community, and then they see everyone in the village who wants to be seen, and that tends to be pretty much everybody. There is a role for traditional healers, and the interface between the Western medicine and the traditional healers is pretty smooth. Many patients go to traditional healers. So the traditional healers feel that it's out of their range. They'll send them to the Western doctors, and sometimes the Western doctors, if they're not getting the kind of cooperation they want, will call in a traditional healer to try and get some, additional cooperation from the patient. It's a wonderful experience. It's good for everybody.